Okay, hi everybody. Imogen and I are back for another little chat, and this session we're going to be talking all about those annoying little injuries that we get to things like little fingers, little toes that we can't do too much about, but there are some little points and hopefully some tips that you can do to make sure that you can try and function in the best possible way in your normal everyday life, or whether it's with exercise as well, if you feel that that is stopping you from doing that. So, first of all, welcome to Imogen again. Thanks for joining me.
Thank you.
Okay, so obviously a little finger and a little toe, they are really annoying when they get either broken, sprained, strained, you know, so they can be a bit debilitating depending on what sport you do, maybe. So obviously if you're a runner or a cyclist, something like a little toe is literally possibly going to stop you from doing that activity. Or if you're someone like myself, does a lot of training in the gym where you've got to grip things, pick up weights, etc. That can be tricky. Or like a recent client of mine actually did kind of break her little finger. She's a netball and a handball player, and that's obviously really tricky for her as well, kind of in that particular sport. So Imogen's going to talk a little bit about the process of what we can perhaps do to support those things, and how we, in the initial acute injury stages, particularly when sometimes, either some people won't actually necessarily go to hospital to have this kind of looked at. They know they've just sprained it or strained it, and they just have to see how it goes, unless it's obviously looking at like it's gone at a funny angle. Some people don't necessarily need that option, and sometimes even when you do go, it might be a case of it something might have slightly dislocated, or it's just extremely bruised or sprained, and they're not really going to do anything. It's not like another broken bone where they're going to set it in place for you. So you're not going to necessarily get that particular advice or support from the hospitals. So Imogen, I'll put it over to you. Broken toes, sprained toes, little fingers. What can we do to support those areas to protect them? How much should we protect them once that's been done? And can we do? Is it something we can do ourselves, or do we need professional support? Talk us through it.
Okay. So I kind of like with what you're saying, we're kind of assuming that this is kind of straightforward, just a sort of injuries to little fingers and toes, nothing that might be too nasty, because some cases obviously it does need the medical intervention if it's surgeries and stuff like this. So this is just assuming that either you've sorted it already and had that cleared, or that you genuinely can tell that you don't need it. So that's my first kind of like,
Yeah.
just whittle that bit out. If it's straightforward, then generally, it kind of comes down to whether it's broken or sprained, I suppose, would be my attached. Sometimes with these ones it can be really hard to tell whether it's either or.
Yeah.
So essentially again it's kind of be led by what your experience, what sensations you're feeling, how it's presenting. So is there a lot of swelling and things like this? So if you're finding it's quite painful, there's a lot of swelling and things like this, then obviously where we've talked about acute injuries in the past, the principles with resting it, icing it and all this type of thing will apply. And I would certainly follow that sort of over that sort of first sort of 48-hour window, just to allow it to kind of settle, kind of get yourself to reassess as once it's calmed down from the initial injury, what actually it is that's happening,
Yeah.
and just allow for any swelling. So generally, if possible, in that sort of first 48-hour window, I would tend to recommend to sort of follow those protocols. So not really, if you are going to be doing sport, obviously, trying maybe not, or postpone to a later date so that you can kind of assess what the situation is, if applicable. So sort of staying away from the strapping side of stuff in that window, just like I say, just to allow for that swelling and that initial recovery phase to occur, because that will help greatly later down the line. If there's not too much swelling and it's not too sort of bad, then I would sort of go down then of being like, okay, well, I can move it. It's not too swollen. There doesn't look like any visible bruising and things like this. It's just sort of generally sort of like the sprains and stuff can be quite sore, especially if you're palpating, or then if you're using it under the load, like say with grip and things like this, or for runners and stuff, if you're putting load sort of excessive force through. So in those sorts of scenarios, then that's where you might find then the taping and the supports helpful.
Yeah.
And again, I kind of will dictate depending on how it's presenting on what way I would suggest to tape. So if you're looking and dealing more with like there's not much swelling, it's sore, needs a bit of sort of almost sort of like reinforcement sort of support, rather than actually like protection, then I would go down the line of the taping, and you're essentially splinting it. So you're taping it to the uninjured digit, whether it's a toe or a finger. And I think most people are pretty aware of how to do this, but ideally, depending on whereabouts on the finger it is, but for most, you would want to tape it below the top of the finger, just so that you still have movement at the tip, so that you can obviously encourage the movement. And ideally you want to kind of keep the finger straight, so you don't want to be pulling it over and across to the other side or toe. So to keep it straight, you'd be using like generally it's like your little bandages and stuff you can get, I forget what they're called, but the little ones, so that you can sort of pad between just to kind of support it, keep it straight, and then tape that. Or there are supports and stuff I think you can buy specifically for this online if you didn't want to sort of makeshift yourself, and again that kind of will depend what you're doing as to how much you want that sort of support and stuff. Obviously something that's going to require a bit more, you'll probably want a bit more support there. So generally, and I would generally, if you're working on that side of things, it's essentially the time periods where it's going to put more risk to injury or preventing the recovery. So if you're going about day to day, and generally it's not too stressful, so if you're in office jobs and things like this, generally I would say that you wouldn't necessarily need it strapped in those sorts of settings. It's like you say, when you're going into more sports, so if you are sort of a netball player and you've got balls likely to being thrown, you just want that sort of extra sort of support to kind of help prevent any further injury. Is where you'd kind of want to do that. And then as the time frame of doing that, again, you kind of a little bit led by the own sensations in terms of how it's recovering and stuff. But again, I would generally look again following that sort of recovery process. You're probably looking sort of anywhere from the sort of like 3-day mark up to a couple of weeks, I would say. But again, the level of support and how often you're using this might vary depending on how it's recovering. And then in terms for the strapping side of stuff, so this one I would tend to suggest more for when you actually probably do need a little bit more support. So maybe if it is broken, generally I would still eventually get to that stage of the splinting and stuff, but I would have a step in between. And that's more probably, you'll see it probably more commonly with the fingers, where you get them put into the like little, it looks like a little bed, a little like case that you can get. And that's just basically it's a protective thing for just one finger and stuff, and then it can be a bit more padded, and there's it's not particularly hard, but it's sort of more like reinforced foam type material, so it's a little bit more protective than just tape and any bandaging type material that you'd use. So there's just a little bit extra, but that one then holds it a little bit more sort of essentially straight and keeping it from too much movement in, which obviously if it's a sort of greater or more severe injury or something where you're likely like netball, that might be something where actually that's more beneficial because you're less likely to injure. And again, it kind of depends on what you're doing. If it is sort of broken, you probably want that one on a bit more sort of permanently than if you were taping and stuff for something that's sprained, just because you just want that little bit of time to have it so that you're deloading, basically not putting too much stress through. So you are still able to use it, but it's just got that reinforcement while it's still in that early healing stage, and then moving on to the stuff taping and stuff to introduce more movement once that has begun to heal a bit more.
Yeah, definitely. And I think, coming back to what you were saying about people, depending on what their usage is of that little finger, toe, etc., if you are in a situation or a job or, your daily activities where you don't need to use it that much, or you don't need to give it that extra protection because you're unlikely to, like you say, kind of hitting a ball against it is likely to kind of re-injure if you're not protecting it a little bit. But in the majority of cases, and it kind of comes back to what we talked about before when we were looking at the ice heat for recovery, ideally, you know, you still want to give that finger toe, once it's past that very acute, obviously, stage, you still want to give it movement and mobility. It's going to obviously increase blood flow to that area in general for repair purposes. So it's going to be sending all the right kind of proteins to that area in your blood that is going to help with that repair process and speed things up. And by not doing that, obviously, we are just kind of slowing it down somewhat. So you want to increase, you know, the rate of repair, which is really important, and just general kind of mobility. Now, obviously, you know, fingers and toes aren't massive in terms of, you know, you're not going to lose loads of muscle mass by not using it and things like that. But, you know, you do want to still keep a good range of mobility. You don't want joints kind of feeling like they are kind of seizing up a little bit, you know, tightening and not being used. So, you know, again, I always relate it to people who might be strength training in particular, where you have got to grip weights. You know, having a really good grip is very important as part of it. And we do have a grip strength. So we want to, you know, we do want to kind of maintain that, and we don't want to say, okay, well, I'll just spend, you know, a very long period of time just not using that finger, because it is easy to do. And that is one way, you know, if you are, and just a little tip, if you are injured, you can not use this little finger when you're kind of gripping. You should be able to have that outside of your grip zone. Obviously, it's not going to be as easy. So what you might need to do, like you mentioned earlier, you might need to deload a little bit, but still maintain movement through not only the other fingers and using that grip, but you can still then wrap that kind of over the top a little bit or to the side, still get a little bit of usage out of it. You just don't want to obviously kind of overload it, pressure through kind of ligaments and tendons and things. So, you know, you do just have to be careful on that side of things. So it's not necessarily going to stop you doing from what you want to do, perhaps exercise wise, strength training wise, etc. But you do just have to be really mindful of it. There's no point in kind of going in and just kind of saying, oh, it's a bit of pain, you know, even if it is just really badly kind of sprained, or you've got lots of swelling and bruising and things like that. You know, and obviously the bruising is an obvious one to tell you how far along the process it is in terms of repair as well. That gives you a little clue. But, you know, don't totally stop using it. Do kind of make sure that you've still got function through there as much as is possible. You know, I always say with injuries, you know, don't not use things at all, but certainly don't push past extreme pain barriers. You know, there's a difference between something feeling painful because it's bruised and something that's actually feeling painful because you're putting far too much pressure on ligaments, tendons, or, you know, again, if you have got a minor kind of fracture of some kind, we don't want to impair that, you know, that fracture repair as much as possible. So it's just being mindful of knowing the difference between those. The other thing maybe to talk about just briefly is just about pain relief. So obviously, I know we've talked about this before in terms of other injuries when we've talked about using, you know, cold packs and things, not necessarily for repair purposes, but actually just kind of numbing the pain. So again, you know, initial injuries, fine to use things like cold packs, or even, you know, things like paracetamol and ibuprofen and things in terms of the pain element. But again, it's not something you necessarily want to keep taking unless you absolutely have to, because again, you just impair your body's natural repair processes, but also your sense of how repaired and how much better you're feeling with that particular injury, and you don't want to be taking anything that's going to mask how much pain actually you might be in if you hadn't have taken it when you start getting back into training of whatever kind that might be, you know. So you don't want to kind of numb some form of pain sensors and then go and kind of do some training and then actually re-injure because you didn't realize how painful it perhaps it still would be. And I think that's perhaps an important thing to mention as well, isn't it?
Yeah, very much so.
Yeah. Okay, well, this was just going to be a little quick one from us today, just to give a few top tips if you are someone who's experienced, or maybe you've got a reoccurring injury on a toe or a finger or something. Particularly, I know, as I say, I mentioned my particular client who plays netball and handball. It kind of comes part and parcel of playing, certainly at certain levels anyway. So it could be something that is reoccurring. So maybe just gives you a few little tips on quicker recovery, which you're going to need if you want to get back into your sport or activities as quickly as possible. As per usual, obviously, if you've got any specific questions for us, you'd like to answer something which is really relevant to you, training, whether it is, for an event or whether it's for just your general everyday kind of exercises, aches and pains, things to do with as we get older, differences for men and women, any of those kind of things, we're happy to try and tackle for you. Thanks for joining me, Imogen.
Thank you.
We'll see you again next time.